Welcome, everyone, and thank you for joining us this morning or this afternoon, depending on where you're located. We're so excited to have you with us today for this important conversation beyond the numbers, the impact of HIPAA and HR non-compliance on your bottom line. My name is Jill Hasselmann. I'm the Chief Growth Officer at HR for Health, and I'm joined by Matt, CEO and co-founder of Abye. And together we work with thousands of practices just like yours. And what we see time and time again is that compliance isn't always made a priority, and it really needs to be. And it's not just about avoiding fines, it's about protecting the foundation of your business and of your practice, your people, your data, your reputation. And so today we're going to break down really the real world impact of both HIPAA and HR non-compliance. So we're going to walk through the hidden costs and the risks that you might not even realize you're exposed to. And most importantly, how you can proactively protect your practice with the right systems in place. So my mission, Matt's mission, while our products are slightly different, while our initiatives are slightly different, our goal really is how do we proactively make sure that you are putting yourself in a place of protection as opposed to in a reactive place if something comes up. So whether you're here to better understand kind of the legal pieces of this or improve your operational processes or just, stay ahead of the curve, that's what we're going to do today. So HIPAA and HR compliance, again, might live in different parts of your practice, but the risk that they carry affects your practice as a whole. And so you can't really focus on one side or the other. You need HIPAA and HR. You're still exposed if you have one or the other. But to kind of set the foundation, Abide is addressing this external risk. So data protection, security practices, patient rights, things like that. And then HR for Health is addressing the internal risk. So how you're hiring your team, how you're managing them, how you're parting ways with them if you need to. And so together, it's really this holistic approach to compliance. So everything from cybersecurity to wage and hour laws, from HIPAA logs to employee classification, really what we want to cover today. And so this is a breakout of what we're going to be going through. We're going to start with what are the hidden costs of HIPAA non-compliance, and then go into some of the pitfalls on the HR side and what the costs are there and their consequences. And then we want to make sure that you feel like you have some solutions walking out of this. And so what are some small places that you can start to help put some things in place to mitigate these risks? And really looking at how does this help with building this culture of compliance and really treating your team and your patients right in what they, and how they are deserved to be treated with some of these strategies. I also want to highlight, we do have a lot of content to go through today. We are going to do our best to get to questions at the end. We do have time allotted at the end. If for whatever reason we are not able to get to your question, we will reach out individually to make sure you get that answer. We have team members from Abide and HR for Health that are monitoring the chat and the Q&A. So please feel free to submit your questions throughout, again, whether we're able to answer them with you individually or live on this webinar, we will make sure that we get to them regardless. So without further ado, I want to kick it off to Matt, kind of setting the baseline for what compliance means with HIPAA and what is the worst that can happen. So Matt, welcome. Thank you for joining us, and I'll let you take it from here.
Yeah, Jill, thank you. I appreciate the introduction, and good morning or good afternoon to those that are joining us today. We're super excited and honored to be on with HR for Health. They're a great partner of ours. We have so many synergies, but really don't overlap at all. And it's a very complementary relationship. And so we know that we have a lot of customers that utilize the HR for Health platform and vice versa. So for those that are on and customers of ours, we thank you for your business, and hopefully we've got a lot of good information, updated information to go over with you today. But a good place for us to start as we look at the hidden costs of HIPAA non-compliance is just setting the baseline. And what does it even mean to be compliant, right? If you ask probably 10 different providers or practices, what does it mean to be HIPAA compliant? You're probably going to get about 10 or 11 different answers. And so to set that baseline, our definition of compliance is that it's documented proof, and Jill mentioned this, of a culture of compliance within your organization. And so most practices do a great job of the culture, setting the culture, ensuring that I think we all understand in today's day and age, right? It can't be the wild, wild west when it comes to our data and the sensitive data that as practices we have access to or we store or we're saving or giving to our patients. And so with that culture, most practices are doing a great job, but unfortunately it's the documentation that seems to slip through the cracks. And so we like to think of compliance almost as like a puzzle picture, right, where you have multiple pieces all being documented appropriately in the government's format to ensure there's that documented culture within the practice. And without one piece of the puzzle, you don't have a full picture. And so as we get going here, the first step or the first piece in that puzzle picture is what the government outlines as a security risk analysis. And it's actually where we're going to start here with the most common HIPAA violation. And there's a number of reasons why, and we'll kind of get into it. But the biggest one that we see is this missing security risk analysis, which usually trips up most practices as they go through an audit or investigation from the Office for Civil Rights. And so without this first piece of the puzzle, you haven't set the baseline for your compliance program, and then you're not going to survive the government's initial inquiry. And so the risk analysis is a requirement for all covered entities under the HIPAA security rule. It's the first step to assessing potential risks and vulnerabilities to PHI or protected health information found in your organization. And it must be documented, and it must be thorough, and it must be accurate. And the government, if there ever was an investigation into your practice, they're not going to just come and knock on your door and ask you a couple questions and then leave. They're not going to observe your day-to-day operations and make their determination. They're going to ask for first proof of a security risk analysis. And so let me just kind of go through the layman's term definition of this, right? It's a self-evaluation of your practice within physical, technical, and administrative areas where you identify safeguards that you have in place, which is the easy part. But the government also wants you to identify areas of your organization where you might be vulnerable or have elevated risk in the event of a PHI breach, protected health information breach. Once your organization has identified the risks within those categories, the government then wants you to implement solutions or strategies or processes to mitigate any vulnerable areas. Now, for healthcare practices, it's hard to know what safeguards you need and that you don't currently have in place. Because if you knew about those gaps, you probably would have already implemented those solutions at this point, right? Or at least have a plan in place to do so and take care of those vulnerabilities. So we understand, right, as a doctor, an office manager, administrator, someone working in billing or coding, if you're charged with HIPAA, right, if this is at an added burden on your plate, right? It's just one more hat that you have to wear when you're doing a million other things each day. How are you supposed to identify what is considered a HIPAA risk and what's not? And we understand that. We understand that challenge here at Abye. And so that is a challenge for small and mid-sized medical practices that don't have compliance teams or CIOs or CTOs, right? Most of you all don't have the time, energy, knowledge, expertise to make sure this is getting done accurately or thorough enough, but it still has to get done one way or another. And so as we kind of unpack this security risk analysis, what the government's done recently is really eye-opening. We've seen a trend from the Office for Civil Rights on what they call initiatives. So just last year, they announced a security risk analysis initiative where they're planning to focus on ensuring organizations have that SRA in place when investigated. And so as you can see, they have been collecting on this initiative. It's only been in place for about 6 or 7 months now, and they've levied nearly $1 million in civil monetary penalties through this initiative. And we all know that, when the government starts drilling and they find oil, what are they going to keep doing, right? They're going to keep drilling. So this is something that we a trend that we definitely expect to see continued even through the transition of administrations, which we thought was quite interesting. So again, not to get in a political conversation, but last year, we had a different administration that initiated the security rule initiative. And now the next administration is running with it. So very much a bipartisan effort. In December of 2024, to give you a little update as well around the security rule, which contains and is where the SRA comes from, but the OCR also released a proposed update to the security rule. So this introduces significant changes that all covered entities and your business associates need to be aware of. The first key update here is that they're going to talk about mandatory cybersecurity safeguards. So one of the most important updates is that many previously recommended cybersecurity safeguards are going to now be required. For instance, practices will be required to implement multi-factor authentication and maintain asset logs for their organization. And these safeguards, they're going to be critical for protecting sensitive patient information, ensuring that access to your systems is secure. So what once was a suggestion is now a is now a compliance requirement. The update also introduced new obligations for business associates. So specifically, business associates will now be required to be certified by a cybersecurity expert annually. This is an important change as it ensures that third-party vendors are also upholding the same high standards of security, reducing the risk of a breach coming from a partner or from a contractor that they might use. In addition to that, we also saw another major change, which is the requirement for covered entities and their BAs to notify impacted parties within 24 hours of discovering the breach. So this ensures that patients are quickly informed about any exposure of their sensitive data, which can reduce harm and support transparency in the case of an event. And then the final little piece here to this to the security rule update is the update also clears any confusion surrounding the SRA and the requirement. It's now explicitly stated that this must be conducted annually, providing clear guidance for practices on what is expected for maintaining compliance within the security rule. So it was always addressable in the past, at minimum on an annual basis, but now it is mandatory. So these updates are likely to be enforced within the next year. So it's essential that your practice starts preparing now, implementing MFA or multi-factor authentication, reviewing business associated contracts, ensuring annual risk assessments are up to date. Those are just some of the changes that we've seen in that SRA update from the Office for Civil Rights. Another initiative that we've seen comes around patient right of access. I just talked about the security risk analysis initiative that the OCR implemented, but they actually set precedent with this patient right of access initiative back in 2019. They announced their first initiative and is focused on ensuring that patients receive their protected health information in a timely manner. This was initiated actually in large part due to the numerous patient complaints that they've received over the last few years. And even still today, patient right of access continues to be one of the main triggers to OCR penalties. In 2022, the OCR levied 11 right of access civil monetary penalties in one day, actually broke the previous record of 5. Recipients of the OCR's enforcement included practices that refused to provide or delayed providing patient records after requests were made by the patient or by the patient's authorized personal representative. Another big takeaway here for those that are on our webinar today, 56% of all of the right of access fines since 2019 have been to independent practices, resulting in over $2 million in penalties. This just proves that no organization is too small to miss the government's crosshairs. They're not just focusing on large organizations. Some additional common HIPAA violations that we see are inadequate technical safeguards. It's one of the main contributing factors that we see leading to data breaches in healthcare. And a lot of times these vulnerabilities are often discovered only after a significant incident, like a ransomware attack. And so when your practice lacks proper technical safeguards, such as firewalls, encryption, or secure backup, it absolutely opens up the door for malicious attacks, including ransomware, which hopefully most of you all know about. Unfortunately, these vulnerabilities are often only revealed again once that attack has occurred, which typically is too late to prevent the damage. In fact, large healthcare ransomware attacks have increased a staggering 264% in the last 5 years. This is a dramatic rise, and it highlights the growing sophistication of cyber criminals targeting healthcare organizations, practices that fail to implement robust cybersecurity measures are absolutely at a high risk. And, we almost even can back that down and say those that aren't implementing just best practices, maybe not even robust, but best practices when it comes to cybersecurity, can find themselves at risk of a breach. Other area that you see on this slide is improper access controls. And so it's not just about securing your systems, it's also about ensuring that only authorized personnel have access to PHI. One of the biggest mistakes practices make is not regularly reviewing who has access to sensitive patient data. So over time, staff leaves, right? There's staff turnover, roles change, or there may be a need to access different systems, and those changes often aren't tracked properly. A lot of times it's the IT company implementing new technology, and those changes just aren't documented and tracked appropriately. So reviewing those staff changes and staff access to PHI is essential for ensuring that only the right people are getting access to the right levels of protected health information. And so we've seen that this practice, when you do so appropriately, will absolutely minimize and mitigate the risk of internal threats, and it ensures compliance with privacy regulations and this patient right of access rule that we're talking about as well. Now, when it comes to non-compliance, right, the cost isn't just limited to the fines imposed after an investigation. In fact, we're going to go through in the next few slides here. The financial impact of a breach can be much more extensive, affecting multiple aspects of your practice. And so these breaches they're definitely far more costly than most practices realize. So I want to walk through you on the next few slides just what the steps are to mitigate a breach and potentially the costs associated with doing so. First thing that you're going to want to do after a breach, right, is get your systems offline, likely with the assistance of an IT company. And so that first step when a breach is detected is to work with your IT company and get those affected systems offline. It's done to prevent further data loss and isolate the breach. Now, often a practice will need to call in an IT company to help contain the incident, like I just mentioned, assess the damage, and ensure that the breach is stopped before it's spread. After the immediate breach is contained, the next step is you're going to want to start rebuilding your system. So it typically involves replacing any compromised servers or computers, upgrading encryption methods, enhancing firewall protections. Now, these steps are necessary to prevent future breaches and safeguard your practice's sensitive data, like patient records. To fully understand the extent of a breach, a forensic investigation is going to be required. Now, this involves cybersecurity experts. They're going to review your systems to pinpoint how the breach happened, what data was affected, and whether there is still a threat present. Now, these investigations are thorough, they're detailed, and come with a significant price tag. Once the breach has been investigated, restoring your data is critical, right? So this means retrieving lost or compromised patient records and ensuring they're restored to a secure, compliant state. Depending on the scale of the breach and how much data is lost, this absolutely can be an expensive and time-consuming process for a practice. Now, there's not many widely publicized examples in the dental industry or even healthcare in general when we're talking about data restoration costs that we have access to, but they're absolutely common across many different industries. This happens all the time. And so we've seen for a dental practice, restoration of encrypted or lost patient records costs somewhere between $3,000 and $5,000. So that could include restoring backups or using third-party recovery services. And given that healthcare organizations often work with large databases of patient records, these costs can escalate quickly if backups were not properly managed in the first place. And then there's a lot more that goes into it, right? We're going to touch on some of the soft dollar costs here in a second, but some of those hidden costs that we see are legal fees or regulatory penalties, obviously HIPAA penalties that come with the lack of compliance or with the breach. We're going to talk about this in a minute as well, but reputation and patient trust can absolutely be severed through a data breach process. And so depending on the severity of breach, the cost to your practice can escalate quickly, easily exceeding, as we saw here on this slide, $35,000. And it doesn't include the reputational damage or regulatory consequences that often follow. Healthcare practices must be proactive. Jill hit on this in the beginning, must be proactive in implementing security measures to avoid these costly and disruptive incidents. A breach not only disrupts your operations, but remember, it can have a long-term financial consequence. So being proactive and investing in compliance and security now can save you significant costs and headaches, more importantly, down the road. Now, once your practice is aware of the full scope of the breach, there are critical next steps that you must take. These actions not only help with compliance, but also minimize the impact of the breach on your patients and your practice. So you're going to want to notify patients within 30 days of the discovery of the breach. This is a federal law. I would throw in a little caveat here. I would recommend you take a look at your state law, because there are some states out there where the notification timeframe is a lot less than 30 days. California, Texas, to name a few. HIPAA requires that you notify those patients through documentation. It's not just a regulatory requirement as well, but it's also a key part of maintaining the trust with patients. If your breach is large enough, if you have over 500 patients affected, you're going to require a public notification. So a press release is going to be part of that. That's $100. It could be around $100 or more, depending on the distribution and the scale of the breach. If the breach impacts a significant number of patients, more comprehensive communication might be needed. Could cost somewhere, around $20,000, $25,000, depending on the patients. And kind of where we're pulling this number from is we actually had recently an organization go through an investigation after a breach. And as they were trying to make sure that they notify their patients accordingly, they actually looked into a breach notification service. That service was going to charge $1 per patient that they notified, and this practice had 25,000 patients. And so this absolutely can become a large cost associated with just notifying the patients that their information could or was part of the breach. One other area that you may have to look at in the case of a breach is providing credit monitoring and identity theft protection. These costs, or the cost for these services, typically range from $10 to $30 per patient, depending on the provider and the level of protection offered. Now, for a large practice, this can clearly add up quickly, particularly if there was a large number of patients affected by the breach. And then the other area that you see on the screen here is you may need to notify the Office for Civil Rights. So in the event that the OCR decides to investigate your practice, clearly the costs just don't end with the breach response. You're going to need legal representation, as we talked about, to navigate the investigation in compliance requirements. If you decide to hire a lawyer, you're looking at significant expense. Legal fees for an experienced attorney specializing in HIPAA data privacy and security can range from $100 to $1,000 per hour. I'd have to say $100 is really low. Should throw up a red flag if that's the cost of your healthcare attorney. But depending on the level of expertise, it's absolutely going to cost some money there as well. So what does this mean for your practice? It means that the financial impact of a breach can extend well beyond the initial response efforts, from the direct costs of patient notifications and legal fees to the long-term expenses like credit monitoring. The total cost of a breach can add up quickly. It's why it's so critical, again, to be proactive with your organization. Now we have here some of the financial costs, associated with potential HIPAA violations or corrective action plans and monetary penalties. The penalties that your practice would face depend on the culpability or maybe the level of negligence associated with the breach. The Department of Health and Human Services, who oversees the Office for Civil Rights, has broken down the penalty tiers into 4 different classifications, right, depending on the severity of the breach. You see those on your screen. So tier 1's lack of knowledge. It's the least severe of the level of violations. It applies when the practice didn't know and couldn't have reasonably known that a violation occurred. And so while the practice may not have intentionally violated HIPAA regulations, a lack of knowledge could still result in penalties. So negligence is just being unaware is no longer an excuse. Now, the minimum fine here you can see is really low, but the maximum penalty, escalates quickly. And this is a per violation figure. So if there are multiple violations, it can add up even in that lower tier. Next tier is reasonable cause. So this applies when the practice should have known about the violation, but the violation wasn't uh, uh, due to willful neglect. It suggests a lack of proper compliance oversight, but not necessarily malicious intent. So the penalties start to grow here, be a little bit more substantial. Tier 3 is willful neglect that is corrected within 30 days. So the violation was due to willful neglect, meaning the practice was fully aware of its noncompliance, but failed to take corrective action in a timely manner. However, if the issue is corrected within 30 days, the maximum penalty is capped at the number you see on your screen. So the penalties for willful neglect, even if corrected, are definitely significant. And then that fourth tier, that's pretty much you're just burying your head in the sand and saying you don't care, which we've seen, unfortunately. It's the most severe tier and applies when the violation is due to willful neglect and the issue is not corrected within 30 days. If the breach is not addressed in time, the penalties can be substantial with no cap on the total fines for the year. And so this is where the financial impact can obviously be devastating to large and small organizations. So violations related to willful neglect or lack of correction action plan can lead to massive financial consequences, as you see on your screen here, with fines ranging in multi-million dollars in extreme cases. And now, while we've already discussed the substantial financial impact of compliance breaches, the fines, legal fees, and the cost of mitigation, it's important to recognize that the true cost of non-compliance goes far beyond just the monetary expenses. So non-monetary costs can have long-lasting and profound impacts and effects on your practice. And often those are just as damaging, if not more than the financial ones. So we want to take a closer look here over the next few slides. The first one we're going to talk about is extended periods of downtime. It can absolutely severely impact your ability to operate. Systems, as we talked about before, may need to be taken offline for security assessments, data restoration, or forensic investigations. So this would leave your practice without access to critical systems such as EHR, your other patient records you might have outside your EHR system, and even communication tools for patient revenue cycle operations. This downtime can prevent you from seeing patients, processing claims, right, or having access to that sensitive data. So it can be a big detriment to the organization. We've heard recently, probably most of you all, I know I received a letter in the mail about my information being affected through the Change Healthcare breach. So this is an example that we've seen. It caused significant operational disruptions across all of healthcare. Providers weren't able to process claims, leading to delays in patient care and financial reimbursement. So there was absolutely a ripple effect on providers. So the patients were affected, yes, but that ripple effect it really includes the entire healthcare system, and was felt as providers struggled with claims, denials, delays in reimbursement, and disrupted workflows. Patient care was affected as well because providers didn't have access to the data that they needed when they needed it, and they weren't able to process treatment plans or properly care for patients. And then the final area that we just want to draw to your attention on this slide is just, months to years of uncertainty beyond this, right? So the investigation process following a breach is another major time drain. So if the OCR comes in or there's state attorney generals that even come in, you're going to have prolonged uncertainty around gaining access to this information. There's going to be constant distractions during this period of time. Your team is likely going to have to deal with constant inquiries, document requests, meetings with legal and compliance efforts. I think you're starting to see the case build here around the potential distractions and the time associated with those distractions if there was a breach. Beyond the immediate fines with the HIPAA breach, we also have corrective action plans that can be part of the government's final resolution. And so what is a corrective action plan? Corrective action plan is a structured agreement between the Office for Civil Rights and your practice. It outlines specific corrective actions that your practice must take to improve compliance with HIPAA and prevent future breaches. Now, these actions can range from implementing new security measures to undergoing regular compliance training or even updating your security infrastructure. These aren't short-term fixes, all right? So these typically last about 2 years and require your practice to be under constant government monitoring during this time. It means you're going to be subject to regular check-ins, audits, assessments to ensure that you're meeting the OCR's compliance expectations. Not to mention, this can also open up the door for other government agencies to take a look at what you have going on, like the IRS, like the Department of Justice. I think we all understand we don't want the government looking over our shoulder. Um, During the corrective action plan, your practice, is going to be monitored by the government, as I mentioned before, which again puts an administrative burden on your organization. It's going to impact daily operations. You could potentially have that reputational damage, as we've discussed before, and ultimately, it's something that I don't think any organization really wants to have on their plate, considering all the other areas that you're being pulled, or all the directions you're being pulled in on a daily basis. HIPAA fines can follow your practice forever. They can linger on your record indefinitely. Even if the violation is resolved, the fact that your practice was penalized for noncompliance can continue to affect how others perceive your organization and your ability to handle that sensitive, protected health information. So any investigation or fine issued by the OCR can become a matter of public record. That means that even years after the incident, patients, potential partners, they can look and they're going to see that your practice went through an OCR investigation and had a corrective action plan levied against it. Could potentially lose trust from current patients as well, right? So the trust that your patients place in your practice is probably one of your most valuable assets. You probably will agree with that. And if a breach occurs, it can cause that trust to erode, as patients may feel that their personal and sensitive information is no longer secure with you. And so when patients learn about a HIPAA violation, we've seen this. They start to question your practice's ability to safeguard their information. It immediately throws up some red flags. It increases the anxiety, as they may sense or they may feel a sense of personal vulnerability, worrying that their PHI could have been exposed or could potentially be exposed in the future. So, it could be an emotional toll on your patients as well. And it could affect losing future patients, right? As this information is made public, the future patients would be aware, and obviously a negative relationship there around data security could potentially harm just the revenue for the practice. And, ultimately, when you lose trust, rebuilding that trust takes time. So you're going to have to go through a reputation recovery process, and you may lose out on some opportunities that you would have had beforehand. And so the impact of a HIPAA violation on your practice's reputation is a long-term cost that cannot be underestimated. It'll affect your patients' trust in your organization, ultimately affect your bottom line as well. One other area that we thought about as we were pulling together these slides is most, or a lot of smaller organizations, within the practice name is the provider or the owner's name, right? Dr. Smith's Dental Care. When that happens and they search for those HIPAA violations, when your name's associated with that, right, it's going to follow you around. And so it's something that we absolutely recommend that you be proactive and ensure that the compliance program is up to date, and also your security processes are in place as well. There is a HIPAA wall of shame as we kind of talk about how this follows you around. So if you had a data breach or there was a corrective action plan put in place, it can be found right on the government's website. So it is something that is available for public record and public insight. As you can see, a lot goes into HIPAA compliance and ensuring that you're meeting the government's requirements, and it's crucial to be proactive. And should there be an issue, right, even the hard cost should be a detriment. But when we look at these soft dollars as well in some of the other areas, it really is a no-brainer to make sure that your compliance program is in place before the incident occurs. Jill?
Thank you, Matt. That was a lot of great information. And I know towards the end of the webinar, we're going to talk about some solutions for a lot of what Matt was talking about. But before we go into that, we do want to also talk about that internal risk that I mentioned in the beginning, and really looking at what does HR compliance mean, and how should we be approaching this problem to solve in our offices, because HR compliance is not just about paperwork. It's what is protecting your practice from lawsuits, audits, and that reputational damage that kind of, sinks over into this side too that Matt was talking about. And so what we see on our side is before we start working with a client, it's very common for us to see these violations that could have easily been prevented with better systems. So better handbooks, better hiring processes, classifying employees correctly, and more on that note. And so if you are not familiar, or if you're a current client and maybe forgot about this, HR for Health was founded by an employment attorney that just works with healthcare practices. His wife is a dentist. He was seeing that lawsuits were coming against his clients, the doctors, the employers, at an alarming rate for very, very small things. And so while employee handbooks had existed, maybe HR advising had existed, there wasn't these systems that really helped to make sure if something goes wrong, you have the documentation, and really you're doing things correctly day in and day out. And just like HIPAA compliance, HR compliance has both monetary and non-monetary consequences. So when we look at the monetary consequences, this number is a range, of course, but this number from $5,000 to $25,000 is a potential fine for employers that knowingly misclassify an employee as an independent contractor. And this is just the civil penalties. The reason why this is so important is if somebody is classified as an independent contractor, they are not paying taxes the same way an employee is. They aren't having taxes taken out of that payment. You as a business aren't paying taxes in the same way. And so there's two departments that care about this. There's the IRS and there's the Department of Labor. And so this is really a big deal that's also extremely common. What we hear all the time is, well, I've been doing this forever. Or when I was working at an office before I owned an office, I was an independent contractor. Or my CPA told me this person should be an independent contractor. And it's really important you go through the steps to make sure you know if somebody should be classified that way, or you're comfortable with the risk knowing they're not. Recently, we got connected with a potential client of HR for Health. The reason why they were connected with us is they had a individual in their office that was going out on pregnancy leave, and that person felt that the way that the practice has handled their leave was not correct. They didn't feel like they were getting the payment that they should, the protected leave aspect, and so they filed a complaint. And what happened when that person filed a complaint is the Department of Labor found out that person was an independent contractor, which didn't add up because an independent contractor isn't eligible for leaves. And so what that did was open up an entire investigation by the Department of Labor of what else are you not doing correctly if you're not doing this correctly. And so we're going in there to try to help clean it up, but it's definitely a lot of work. And it's again, this number on the screen is just the civil penalties. That doesn't come with any, back wages that might be owed, any of the attorney's fees. It really, really adds up and can be costly. This number is the average employment lawsuit settlement, particularly around discrimination claims. This, in my opinion, is actually a low number. We're kind of being conservative here because, again, what typically happens when these claims come to be is you might not be discriminating against somebody, but you part ways with them. They file a claim saying that there was discrimination in the practice. That's why you let them go for whatever reason that they're claiming. And then you're in a situation where you have to prove that that's not true. And that's why documentation is so important. But what also happens is when these claims come, they tack on a lot of other things to them. So it might start out about discrimination, but then they start to look into, well, were they paid correctly for their time off? Did they get their vacation, their sick leave? Were they paid on time? Were they given an I-9 at the beginning, or all the documents that they needed to? So they start to rack up this list of things because the dollar amount grows bigger. And so this is, again, just a starting point, but this is a significant impact to the practice where something like this could easily be avoided. And then if we look at, let's step away from maybe the scary numbers for a sec. I do think that this number is scary, but this is looking at the cost of replacing an employee, and that's 1 to 2 times their annual salary. And so I want you to also look at compliance as caring about your team and how it really is essential for, again, not just protecting you from legal risk, but also showing your team that you care about them. And so having HR compliance really take a role in the practice and doing things each day that are maintaining that compliance is setting that legal framework for managing your employees. It's making sure that there's fair treatment, there's consistent workplace practices, and then also helps to avoid those lawsuits, penalties, and audits. And again, we can't avoid that we cannot 100% eliminate any risk of having some sort of claim. But when you have the correct systems in place, similar to Matt's theme of what he was talking about, is it can significantly reduce that either monetary fine, the attorney's work. If you have everything in one system, it's much easier for an attorney to go through and get what they need versus having to ask you to fax over things for them. Again, our CEO is an attorney. We see it. We know like what a lot of these practices have in place. So it's really important. And then also for building a safer work environment and helping to support that retention and employee satisfaction while protecting your bottom line. And again, employees are looking for these pieces to be in place when they go to work for a practice. And we know we've seen this. This is not a recruitment webinar by any means, but we see this, that employees are now having choices of where they want to work, and they have more of an upper hand as we're trying to recruit people. And so it's not the only thing, but it absolutely helps to set the tone when they come into the practice, showing that you care about them. And so I want to dive into the HR compliance a little bit more and really give some examples of the top 5 mistakes that we see when we first start working with a practice, or when we're talking to practices out, at trade shows or speaking engagements, whatever it might be. And most practices that we talk to are making at least one of these mistakes, if not all of them. And these are really like the bare bones. If you're doing these things, this is where I would start to try to put some fixes in place. So first and foremost, not having an employee handbook or having an outdated one is very, very common. We also see, because we're doing surveys constantly, trying to understand where everybody is at and how we help to build tools for them. And so in those surveys, we found that actually the most common way that practices get an employee handbook is from a colleague or a friend. And then they're tailoring those handbooks to their practice. Or they might be using templates and then doing it themselves to try to fill in those policies as they see fit. This is a huge mistake that can definitely be avoided. So while an employee handbook is not a legal requirement, it is a law to have certain policies in writing for employees. These laws are going to be based on federal, state, local. It gets very granular. And so when you're looking at your employee handbook, not only do these policies need to be specific to where you're located and to your practice, but they need to be updated as laws change. So if we refer back to templates and getting an employee handbook from a colleague or friend as being very common, that is super hard to keep up with as laws change. If you're having to go in and change a template yourself because you don't know if you're doing it right, like it's hard to know as these laws change what it's supposed to be in there. And you also don't know if the handbook you got from your colleague or friend is correct in the first place and also is correct to translate to your practice. So if you're receiving your employee handbook from a friend, if you're getting it from a template, even like a payroll company that might not have those health care specific policies in there, like verbiage around patient lists and confidentiality and those sort of things, it's really important to prioritize that and make sure you have something that is tailored to your practice, that again, ideally is updated on an ongoing basis as laws are changing, so you're always protected from that perspective. The other note I want to make on the employee handbook is it's really important that you're using the employee handbook. A lot of the times, again, before we start working with clients, we see, yep, I have a handbook. I just updated it. They're very proud of it. And it's printed out and in the filing cabinet in the office manager's desk. And it's not accessible to employees. They maybe aren't given it at the time of hire. It's really hard to actually utilize the employee handbook as a tool to make the employees more consistent in terms of what you expect from them if it's not accessible and if it's not actually used. So even if you got your handbook from even HR for Health and it's updated this year, absolutely review it and make sure like the policies that are in there, that's what I'm actually following. If you're not doing performance reviews and you have a policy in there that says you do performance reviews, that's a misalignment. That's creating confusion for the team. So you really want to make sure it's tailored and custom to what you're doing in your practice. Next, we see no clear processes for recruitment and onboarding. This is a tough one because I know that so many practices are trying to find good people and fill these positions, and we're working as quickly as possible to get them really what we call butts in the seat to be able to help service our patients. But in this, it really does create a poor experience for candidates and then for new hires. So, some recommendations on this is if you're not using employment applications, definitely use one. Reach out to us. We have ones that we can provide you, but you do need to make sure the employment applications are state specific because there are state laws around what you're allowed to ask candidates. For example, like previous salary that they used to make at a previous role, you're not allowed to ask that in a lot of states. So you want to make sure your employment applications are specific to you. This is a really great way of getting all information about that applicant in one place while also making sure you're not asking things that you shouldn't be asking from them. You also want to have structured questions that you're asking every single person that comes in so there can be no claims of discrimination from that perspective. If you are going to do background checks, you need to make sure you're doing them at the right time in the process. So, again, a lot of states do say you can't do a background check until you have an offer out, and then you can make that offer contingent on successfully completing a background check. We recommend checking references. So all of these things I would put into a checklist and make sure you're doing each time so that the candidates all have a consistent experience and you're creating a good experience for them because you want them to ideally come into the practice. And then you want to have a very clear process for onboarding. What on average, I think a lot of practices don't realize this. We find 100% of practices are out of compliance with this when they start working with us is the new hire documents. On average, there's 12 to 15 new hire documents you should be providing to each employee on their first day with you. And so I would recommend carving out an hour to make sure they complete all of their new hire paperwork. You highlight what is important in that employee handbook for them. What is their vacation? What are their holidays? Clear up any questions and get that out of the way so that they can start working. If you don't do it on the first day, you're never going to do it. And setting them up correctly really does help with retention more than you might realize. And again, ideally, all of this experience is digital and in the cloud. Wage and hour compliance is by far the biggest issue that we see. This is because we don't necessarily pay our employees the way that is typical, meaning just a straight hourly rate or a salary. We might pay per diem, per patient, percent collection, percent production. And so a lot of the times this can lead to employees not clocking in and out because you might be using a time clock that doesn't understand what that sort of structure means. And so some things to review with your current timekeeping. First and foremost, all employees are able to clock in and out, even percent production, per patient, per day. They all should be clocking in and out. It is your responsibility to make sure you have records accurately of what they worked each day. Ideally, your time clock does not have rounding rules in place, meaning it rounds down or rounds up. These aren't absolutely illegal, but there is a lot of case law that has been starting to pop up around ruling in favor of the employee that those rounding rules are not favorable to them. And so I highly recommend you don't have a time clock with that in place. Make sure your time clock is automatically calculating overtime based on your state, for those employees that are percent production and per diem. And then employees are not prevented from clocking in and out based on scheduling rules. So important. Employees should not ever be prevented from clocking in and out. And they should not automatically be clocked in and out. That is, you're just setting yourself up for an employee to claim that they were forced to work off of the clock. So there's other ways in like in our system, it will tag for you automatically if somebody is clocking in too early, if they're, clocking in too late, if they don't show up at all, but you don't ever want to prevent them from doing that. Making sure all of the records are stored and maintained, and ideally your time off and timekeeping are connected, meaning as somebody clocks in, they're accruing their time off, and the employee has visibility to that. Ideally, again, your time clock is allowing for meal and rest break tracking. If you're in states that require that, that's really important. And again, that you're tracking tardiness, early clock ins, no shows. These are all things that you tend to make decisions on, but you don't have documentation to back it up. So having systems that are automatically tagging these things for you can be a lifesaver. Misclassification of employees is a really big one too. Really, this is the debate of exempt versus non-exempt. For all of you to know, a non-exempt employee is really an hourly employee. So this is somebody that's paid hourly wages for all hours worked, or they're paid percent production, percent collection. They're employees that earn overtime. And then if there are meal and rest breaks, they need to be taking those and be in compliance with those. On the flip side, somebody that's exempt is somebody that is making a salary that's based on an annual amount. They're not eligible for overtime pay. They're not eligible for meal and rest breaks. But what happens is that a lot of practices say, well, I'm going to pay somebody a salary, so I don't have to worry about paying them overtime or giving them lunches and breaks. And the reality is that isn't enough to make somebody exempt. Somebody is exempt based on their job duties and what they're doing more than 50% of the time. Really, in our practices and for this audience, a true exempt employee is somebody who's a true office manager. So anybody outside of that in the practice is most likely non-exempt, and you need to make sure they're clocking in and out, getting overtime, getting meal and rest breaks, because those things can add up to really hefty fines. And again, looking at that checklist of your time clock and is everybody able to clock in and out so they're paid correctly is really important. And then last but not least, the termination risk. So first and foremost, termination should never be a surprise if it can be avoided. Documentation is essential to ensure you're as protected as possible when you're parting ways with an employee. So remember, like, an employee could say they were discriminated against, but you maybe let them go because they were late all the time or they weren't showing up to work. And you want to have that documentation to be able to prove that, so it makes that stuff go away pretty easily. Making sure your final paychecks are correct is also super important. This is where a lot of risk comes into play once you part ways again with an employee. This is also why your employee handbook is super important, because a lot of states don't require for vacation to be paid out at the time of termination, for example. However, a lot of those states maintain that whatever's in your employee handbook is what you're required to do. So if your employee handbook says you're going to pay it out, then you have to, even if the state doesn't say that you needed to do that as a law. On the flip side, a lot of those states say if your employee handbook does not state what happens with unused vacation hours, then they should be paid at termination. So those small things are really, really important. And again, having a team to help you around this can be a game changer. So if we think about these compounding costs, the fees for not classifying somebody as an employee when they should have been and classifying them as an independent contractor, the wrongful termination, discrimination claims that can come, and the high dollar amount of that, the cost of replacing an employee being 1 to 2 times their salary, not to mention the morale loss. Like, these issues don't just cost money. They create churn, burnout, and they distract from patient care. So if you take nothing else away from this, compliance means documentation. So all the way from the time that you are bringing somebody into the practice to even interview, to giving them offer letters, onboarding them correctly, having written policies in place in your handbook that are updated and accurate, doing performance reviews, tracking time off correctly. it all adds up to, if you don't have solid documentation around all of these pieces, it's really hard to have that protection in an audit or any sort of legal case. And the good news is we automate all of this for you, so everything is stored and tracked and up to date. So these are your action items, kind of your solutions. How do we stay on top of it all? First and foremost, that automated HR documentation. Make sure you're tracking that performance. You're doing write-ups if necessary so that termination isn't a surprise. You're getting signatures from all of your employees. Those employee handbooks are updated, but also digital and accessible for the team whenever they might use it. Um, do an audit on employee classification. Reach out to us if you have questions on how to do that, because these can be really, really costly. If you're not paying employees overtime, that stacks up every single day potentially, that can result in something really large. Have that time and that time tracking and PTO management fully integrated with one another so that there's no errors or discrepancy in that. Not only is that just good business practice, it also gives the employee a great experience because they have visibility to what is in front of them and what they're able to take. And then again, having that support, we do things like this webinar all the time on all different topics. If you're not an HR for Health client and you're not ready to be an HR for Health client for whatever reason, at least subscribe to our newsletters and blogs. We are constantly, our job for our clients is not just a bulletproof software, it's also to update you as laws change. So we are doing everything possible to help you be proactive. So just keep that top of mind and pay attention as we're doing that. Then Matt, I'll kick this to you.
Yeah, great, Jill. I appreciate that overview. That was awesome as a business owner. And I'm sure we have some business owners on. HR is probably what keeps us up at night more than anything. So
Yeah.
you did a great job of explaining that. And obviously, your solution does a great job of solving the problems that are created. And we like to think that Abye does the same thing, where, if I were to describe Abye, in one statement, it's TurboTax but for HIPAA compliance, right? And so it allows for your organization to implement and sustain compliance when it comes to HIPAA without having to be an expert, without having to take up too much time. You fill in some profile information, you answer some questions on an ongoing basis, and Abye will dynamically generate all the documentation automatically that your organization would need to provide. Obviously, starting with that security risk analysis that we talked about today, with the security risk analysis initiative. And so, yes, compliance is important, and documentation is really important. We feel as though the process within Abye will identify and help identify areas of weakness and areas of risk for a practice as well, which will help them avoid a data breach. And so it's not necessarily just about compliance. If something does happen, it's how can we mitigate the risk as much as possible up front. And we feel like our software does both of those things for a practice. And so we're really proud of the way that it works. And obviously our customers can appreciate the time savings and the peace of mind that they receive with our software.
Mm-hmm. Yeah. And so as we kind of tie this up in a bow, again, compliance should not be something that you scramble to fix during an audit. It should be part of your team's daily rhythm. This is how you're going to reduce risks and mistakes and those fines that could happen. Also, it's going to help maintain and retain those quality team members who value that clarity and structure that's needed. And it's going to help you to build trust with patients and with your partners. So I always say again, compliance is caring. These are the rules that help us to take care of our teams and our patients and our businesses in the best way possible. And so these are, you don't have to be like a compliance expert. That's why we are here. We understand you don't want to be. That's why we're here to help you. So looking at this slide and some of the things that you can continue to do are really important from both the HIPAA and HR side. From HR for Health perspective, this is kind of a visual of what we've built into our software, where employee handbooks are updated automatically. We're working with you to create those, and then we just maintain them as laws change. We make sure you have all of those documents that are needed that we talked about, those 12 to 15 on average. The timekeeping aspect, everyone can clock in and out. The performance reviews, being able to run payroll, having an HR team you can call with support. And Abide has a very similar structure, which again is why we've partnered with them on the HIPAA side. If you are interested in seeing a demo of HR for Health, you can scan this QR code and our team will connect with you. If you're a current client and you want to learn how to utilize some of the features we talked about, feel free to scan this too, and you'll get directed to the correct team. And then same on Abide side. Matt, I don't know if you have any talking points on this piece that you want to add in, but I think same thing. If you guys are interested in seeing a demo, I know if you're an HR for Health client, you do get a discount with Abide too because of our partnership. And actually vice versa, if you're an Abide client and looking at HR for Health, you get a discount. So feel free to scan this. I know that we ran out just in the nick of time. So we weren't able to get to the Q&A, but we will get back to you if we weren't able to live on the webinar today with any questions that were coming through. And stay tuned for our next webinar with Abide and with Matt and myself. We'll be talking more on the OSHA side, which we're very excited about for some of those updates. Matt, thank you so much for being here with us. We really appreciate the expertise and resources that you give our clients and being able to be that trusted source for us. So we're looking forward to the next one to just continue this education.
Thanks for having us. We really enjoyed it.
Thanks, everyone.